Hello and welcome. You're watching this video because either you or someone you care about has been involved in a motor vehicle crash, or you'd like to know how to protect yourself if you do get involved in a motor vehicle crash. I'm Dr. Keith Lynch. I've been in private practice here in Central Virginia since 1998. If you're involved in a motor vehicle crash, let's assume it was a pretty major collision, and either you drive yourself to the emergency room or you're transported to the emergency room by an ambulance. When you're seen by the emergency room physicians, what they're going to be looking for are major injuries to you. So they're going to look for broken bones. They're going to look for lacerations. If you have a broken bone, they will set that. If you have cuts or lacerations, they will give you stitches. They'll more than likely, if you look like you're injured, they're going to give you muscle relaxants, painkillers, or anti-inflammatories. Then they're going to send you home and say, if you still have pain after 3 to 5 days, go see your doctor. What I'm going to tell you is that's not enough. And they're sending you to the wrong office. And let me explain why. First of all, emergency room physicians do not treat whiplash. Remember, they're there to see the worst case scenario as quickly as possible. If you're not dripping blood or have a broken bone, you are not high on their priority. They want to get you in and out of there as quickly as possible. They're going to give you medication to reduce your pain so that you can go home, sleep, and if you need to go see your doctor later, you'll go see your doctor. End of discussion. They're done with you. Now, if you're taking those medications and then they run out, so you just start taking aspirin or Tylenol or Aleve or something else over the counter that you have at home, that's going to mask your symptoms. And you're not going to know really how injured you are. Also, if you go to your medical doctor, they do not treat whiplash. Most medical doctors, the first thing that they're going to do is they're going to prescribe you, once again, pain medications, anti-inflammatories, non-steroidal anti-inflammatory drugs. Those are the types of things that they're going to give you, or they'll give you steroids to reduce your pain. All that is going to do is mask your symptoms. You still have not treated the underlying problem of the whiplash injury. That's what needs to be addressed. I've been practicing in Central Virginia for the last 17 years, and I've been treating people who've been involved in motor vehicle accidents that whole time. I'm the office that you should come to if you've been involved in a motor vehicle crash. Now, what if you've been involved in a motor vehicle crash that you would consider minor? Maybe there's little to no damage to the vehicle, kind of a fender bender. Either somebody hits you at a stoplight, maybe you're in a parking lot, or you're at a stop sign. What happens then? Well, what I'd like to show you first is what actually happens in a low-speed rear impact crash, because I think that will really show you what happens. So this is a low-speed rear impact collision that you're seeing right here. That car is pushed into this vehicle at 7.8 miles per hour. Look at how that person gets loaded into the seat and thrown forward. That's slow motion. You're going to see it now in full speed. As the car comes in, hitting the other car, it's a very quick impact. That's it right there. So what's happening in a low-speed rear impact collision, and the reason that we have more injury from them now is because the vehicles themselves are stiffer and the seat backs are stiffer. So what's happening is as you're sitting there in your vehicle, when it first gets struck, the vehicle is going to move underneath you and you're going to get launched up in your seat. back like this, and then as the vehicle slows down, you're going to start moving faster than the vehicle, and you're going to whip forward. That's that acceleration, deceleration impact, and what it can do is it can tear structures in and around the spine. The ligaments that hold bone to bone can get damaged, and we can visualize this on the appropriate x-rays called flexion and extension, or stress films, to actually see when I lean forward, when I lean back, do the vertebrae stay in their proper position, or are they all out of position? Because when we do those films, very frequently we see that there's been damage to the ligaments, that if you just took a plain film, the type that they normally take if you go to your doctor or the emergency room, you're not going to see the injury. They don't bring out and show you what's actually happened to the soft tissue. And that's okay, because what they're really looking for is whether or not you have a fracture. As long as you're not fractured, you're fine. You're not emergency room material. Go home. If you have pain, call your doctor. You know that already. So this is why these little fender benders are a problem. And as you see, when this happens, there's no damage to the vehicle. So when this guy gets crunched forward like that, look at the back of the vehicle here. No broken glass, fender's still intact, everything looks perfectly fine here. Once again, that's it rolling through at full speed, and this is the person. Boom, real quick. That's all you get. Just a quick hit in the back. Maybe the person's going to get out. Maybe they'll have their hand on the back of their neck or on their head. They'll walk around, look at the bumper, and they'll say, well, there's really no damage here. You know, I'm kind of in a hurry. I'm either on my way to work or on my way home from work. I just want to go home. So they'll just leave the accident. But that's why these injuries can be so problematic. Now, after the injury, what happens? When you contact your insurance company, there's going to be something that happens before the other person picks up the phone. You're going to hear a voice, and it's going to say, this call is going to be recorded. Now, that's important before you ever start talking to somebody, because you are about to get questioned by a representative from the insurance company, and they're going to ask you questions. Those questions were written by attorneys. This is a kind of fishing trip to find out what happened. They're going to record your answers, and they'll use them later to say, well, you said there really wasn't that much damage, and now you're saying there's $4,000 worth of damage to your car. You said you weren't injured, and now you're saying you were injured. Well, let's just look at those two questions by themselves and nothing else. First of all, I myself am not an auto mechanic. I have no idea how much it costs to spray a door or a trunk with paint and match it to the other. I don't know how much it costs to fix a fender. I think I would probably even guess it was less than it actually costs. So you and I are probably not qualified to answer that question. And how about the one whether or not you're hurt? Are you injured? How can you even answer that? You have no idea. You should be evaluated by a properly trained physician to know what's wrong. That's what I am here for. That's what I'm telling you is come on in to me. We can evaluate you. If you're not injured, great. At least you've checked it out. You can happily go on your way. And this way, if you were to ever get injured in a further motor vehicle crash or some other type of personal injury down the road, nobody's ever going to be able to point back to this incident and say, yeah, but they were injured in another car crash. It has nothing to do with this one. This is why you need to protect yourself and find out for sure, is there no injury or is there an injury? Because one way or another, you're the one who's going to pay for the price for it, either through pain and suffering, possible permanent impairment, or at least the cost of treatment if you choose to try to treat it. So that's the kind of questions you're going to get. And sometimes insurance companies can be quite combative about doing things to help yourself. They're going to constantly call you and ask you, are you okay? Is your car fixed yet? Can we close this case? That's what they want to do. They want to spend the least amount of money in the shortest period of time and get your case closed so that they don't have to pay you any more money. And I'm not looking for you to get money from your insurance company. I'm looking for you to protect yourself and get treatment if you need it, or at least get the evaluation to prove that you do or don't need treatment. Because when you delay your treatment, you increase the amount of injury that's present, which makes it further possible that you'll have more problems down the road, early and advanced stages of arthritis, and you'll have pain. And when you go to treat that, you're going to be the one paying for it. Now, what about anybody else in the vehicle? You have your kids with you, friends with you, coworkers. They need to be evaluated as well, because it's important to know who's been injured and what the extent of their injury is. When you come to our office, the only thing you're going to need to bring with you is a copy of the accident or police report and a copy of the contact information from your insurance company. We will take care of all the details. We will be the liaison between you and the insurance company through everything that you need to have done, whether that be treatment, collections for it, having everything said when it's done, hey, he or she has reached maximum medical improvement, in other words, pre-accident status. We'll help determine that. We'll let them know. That's what we're here for. When you come in for your examination, you will get a full, thorough examination in a slow, methodical office. This won't be the emergency room. I'm not going to throw your x-ray up in the air, look at it and go, this one's good. We are going to really pay attention and detail to you and your condition. Not only do I have 17 years of experience, but I've been specifically trained for this through the Spine Research Institute of San Diego. So I've been trained in crash reconstruction, biokinematics, serving as an expert witness. If you need an expert witness for your case, I will be there to go to court for you or be deposed for you so that you get what you need to protect yourself and make sure that your case goes through properly. That's what we're here for. The treatment that we do in our office, one of the treatments is called Atlas Orthogonal. It's the treatment that we've been doing the longest over these last 17 years. It was actually recommended by emergency room physicians in their peer-reviewed journal for what to do if you've been involved in a motor vehicle crash. They even say, hey, if you're going to refer to a doctor, this is the type of doctor, this is the type of treatment that we recommend. Couldn't be more straightforward than that, could it? The treatments that we do in our office are all done without any pain, so there's never any twisting, popping, or cracking. Most car accident patients come in, they may have anterior head carriage because they've got damage to the soft tissue in the back of their spine, which means that they're going to have over-tightened muscles on one side, weakened muscles on the other. We do therapeutic rehabilitation in our office, which would include the releasing of over-tightened muscles, strengthening of the other side of the muscles where they're weakened. We do myofascial release on trigger points and the massage therapy that's necessary to help heal motor vehicle crash injuries. We use cold laser in our office to help heal soft tissue injuries that accompany motor vehicle crash injuries. The longer you're injured, the longer you wait, the more injury you're going to have. Don't just take medication, actually get it fixed. The takeaway on this, give our office a call. We'll do everything we can to help you. We're here to help you, and we look forward to helping you. I'm Dr. Keith Lynch. Thank you.